Welcome to Lippy Q, our question of the week for lipedema. This comes from Simo on Facebook. Can you get liposuction for lymphedema? So lymphedema is really a separate condition. It gets confused with lipedema. It generally is unilateral, not bilateral. Sometimes the person can have some underlying lymphedema along with their lipedema. There can also be lipolymphedema, so we have to get the terminology correct, where long-standing lipedema, especially if it's fibrotic, can affect the lymphatics and create lymphedema, and that's lipolymphedema. So let's go through each of these things. In general, with lymphedema alone, liposuction does not have a role with lymphedema. There are other therapies or surgeries for that, either compression or possibly lymph node transplantation, which I do not do. It's more of a specialized surgery by other surgeons. But generally, liposuction does not have a role for lymphedema. If a person has lipedema and some underlying lymphedema, and there's some coexisting, by treating the lipedema and releasing the fibrosis, many times I've seen the lymphedema will tend to make improvements in that patient. If there is lipolymphedema, again, the terminology has to be correct, where lymphedema is caused by the fibrosis of lipedema, those patients generally are more advanced, they have more fibrosis, that be handled in a specific way, more pre-compression therapy, more compression therapy and wrapping after the surgeries. But in my experience, if it's done properly and carefully and the surgeon stays in that safe plane, again, another important concept, never getting down and damaging deep lymphatics, you can release the fibrous tissue, improve the lymphatic flow, and generally there are improvements in the lipolymphedema, in the lymphedema component of the lipedema. So hopefully that answers that question.